Hello students. So today we will discuss about the role of nurse in infection control. So by the image you can see that a nursing officer is wearing proper mask, gloves, and there is a picture of isolation room and hand sanitizer, along with that goggles. So we will discuss today how we can protect infection to spread to the patients. So, the infection control refers to measures taken to prevent the spread of infection. So, it is the nursing officer's main role to prevent the spread of infection from one person to other person. Nurses play a vital role in protecting patients, healthcare workers and visitors. So being a nurse, it is our main role that we have to ensure that the visitors, the healthcare workers and the patients get always protected from infections. And effective infection control reduces hospital acquired infection. So we all knows that effective infection control means the way we will control the infection, it will help to reduce the hospital acquired infections. Moving on to the objectives. So we will see what are the objectives. Understand the role of nurses in infection control. Yes, we have to always give our best to prevent the infections and control it accordingly. Then learn the importance of hand hygiene. Hand hygiene is the basic procedure that we all learn when we enter in nursing, and by that way we can prevent many infections. Okay. Then describe the use of personal protective equipment, that is PPE. I think after COVID-19 or after pandemic, we are very much used to with the word personal protective equipments or PPE. So the use of PPE has to be done properly to prevent from infection, and explain different isolation techniques. So what are the isolation techniques that has to be differentiated properly? Otherwise, by the contamination of many patients, the infection will spread in a larger basis. Okay, now we will discuss the explaining different isolation techniques. So first, there is a standard precautions that is used for all patients regardless of diagnosis. So the basic or the standard precaution for every patient we take, that is hand hygiene, hand washing, wearing gloves, using mask, right? Then contact isolation, that is by the name we can understand contact means when we are coming in contact, we are touching the patient or touching anybody that those are infected. Okay, from one patient the infection may spread to other patient, also to the health workers. Okay, so contact precaution has to be taken properly, that is wearing gloves whenever we are touching patient surface or any patient's equipments, and wearing proper PPE. And then coming droplet isolation. What is droplet isolation? Means which is spread through our sputum or through cough, or by sneezing. So the infection should be prevented by wearing proper mask. And the last one is airborne infection. For infection spread by airborne particles, and for that we require to wear N95 mask. Now we will discuss importance of infection control. So why is infection control to be done? What is its importance? First is prevent the spread of infections in healthcare settings. So we have to prevent the spread of infection if we take proper measures of all the kind of PPE we use, or every time we will use proper hand hygiene techniques. So by that we can prevent the spread of infection. Then protect patients, healthcare workers and visitors. as we are already discussing about infection, so obviously we know this infection can also occur by direct contact. So for that we can use gloves, or we can wear proper gown, shoe cover. So by that we can avoid the contact precaution, and also by droplet precaution, by taking basically proper measures of preventing infection. We can save patients, our own health workers, and also visitors or family members. Then reduces hospital acquired infections. So the infections which come from hospital or during the stay of the hospital, that is called hospital acquired infection. So if we take proper measures to prevent the infection, then the hospital acquired infection rate will also decrease. Then improves patient outcome and recovery. So if the infection will reduce, obviously the patient's quality care will be given and the patient will be treated well. Their illness time will get reduced to some extent, and the outcome or the recovery procedure will be much more better. Then lower healthcare cost and antibiotic resistance. Obviously, if the proper measures of infection control will be there, then antibiotic resistance and the healthcare cost will also reduce. Next, coming to hand hygiene, the key to infection prevention. So the basic procedure which we learn from the first day of our course, that is hand hygiene or hand washing. So how we will do? Wash hand with soap and water for at least 20 seconds. This is very important. Use alcohol based hand rub when hands are not very dirty, like just after measuring patient's body temperature. So we can simply hand hygiene by using alcohol based hand rub. Then perform hand hygiene body temperature. So we can simply hand hygiene by using alcohol based hand rub. Then perform hand hygiene before and after contact. So we know that before and after touching the patient, it is very important to keep your hands clean. Otherwise, that is a very main source of increasing infection or spreading infection. Then clean hands after touching body fluids or contaminated surface. So after touching any kind of body fluids or contaminated surface like patient's bed or the catheter urine bag, so we have to properly do our hand hygiene. And the lastly, proper hand hygiene reduces the risk of infection. Yes, if we do proper hand hygiene, it will obviously reduce the risk of infection. Now, personal protective equipments, using it right. So the use of PPE, that is a very basic thing which we all have to be very expertise with it. Otherwise, it is a main source to spread the infection again. So if we are wearing a gown for infected patient, and we are wearing the same gown and moving to other infected person, non-infected person or patient, then it may lead to transfer of infection from one patient to another. So we have to be very careful. Wear appropriate PPE based on the type of exposure, like where we required mask, we have to wear mask. Where we required gloves, we have to wear gloves. So put on PPE before entering the patient care area. So whenever we are entering to any infected patient, we have to wear proper PPE before entering. Remove PPE in the correct order to avoid contamination. Like we have to discard our gloves, our gown in a red bin. That is very important. So all the measures has to be taken care of. Then dispose the single use PPE after use. So the gloves or the mask or the gown, whichever we use only for one time, so that has to be discarded properly after every use, and not to use repeatedly for one or more patient. Perform hand hygiene after removing PPE. So we know that whenever we are removing anything, our PPE, our whatever it may be, our gloves, our gowns, so we require proper hand hygiene. The next one we are coming, nursing responsibilities in infection control. So follow standard precaution with every patient. So standard precaution are like before and after touching, patient surroundings, patient body fluids. So those are the standard precaution we have to take for every patient. Practice proper hand hygiene at all times. So that is very important, hand hygiene. Use PPE correctly and consistently. We have discussed earlier also. Before entering, we have to wear and we have to discard in a proper bins. Then monitor and report signs of infection promptly. We have to monitor properly and we have to report the signs of infection. Like if the patient is having continuous high temperature after also giving antibiotics, or you are giving PCM, but still the patient is having continuous high temperature. So we have to see all the signs and symptoms. Educate patients' families and colleagues about infection prevention. So this is also very important, because if we are maintaining and the patient family members or other people are not maintaining equally, so that may also lead to spread in infection. Now next is environmental cleaning and disinfection key practices. So we have to be very sure that the environment should be properly cleaned. Clean and disinfect and frequently touched surface regularly. Like the bed rails, we have to make sure that it is properly cleaned with disinfectant regularly. Use appropriate disinfectants as per guidelines. As per the guidelines, we have to see that the disinfectant is being used. Follow correct dilution and contact time for disinfectants. Then ensure proper cleaning of patient care equipments. Like all the equipments, whatever we are using, like a thermometer, the stethoscope, whatever we are using, it has to be properly cleaned. Maintain a clean and clutter-free environment. So if suppose imagine a patient, you are withdrawing some blood and all of a sudden it got spilled. So it doesn't mean that it will be left over like that, or the urine has been spilled from the urinary bag. So it has to be properly cleaned. Okay? Otherwise it may lead to infection. Now, personal protective equipment or PPE. Now the question, what is PPE? Equipment used to protect healthcare workers from infection. Okay, so we have already discussed this. So what it includes, I think now you all can recognize, memorize, and also you can identify, that is gloves, mask, gowns, goggles and face shield. So what are the purpose of it? Prevent exposure to infectious agents. So what are the isolation techniques? Types of isolation, we all can remember now. Contact isolation for infections spread by direct contact. Droplet isolation for infection spread through respiratory droplets. And airborne isolation for infections spread through airborne particles. And what is the purpose of it? Prevent transmission of infectious disease. So we can conclude that nurses are key members of infection control programs. Hand hygiene is the first line of defense against infection, which we all learn from the very first day of our course. And the proper use of PPE ensures safety for patients and healthcare workers. Isolation techniques help prevent the spread of communicable disease. Okay. So this is all for